Good morning, everyone. Welcome to our Saturday morning webinar, Ankle Pain, Kick It to the Curb. I'm Dr. Tay Kai Sian. I'm the head of foot and ankle surgery at Singapore General Hospital, and it's my pleasure to present to you this webinar today. Now, ankle pain is a very common complaint amongst many of our patients. The causes can vary from a simple sprain, torn ligaments, to cartilage injuries, or even ankle arthritis. It can have a significant impact on the quality of life, be it the ability to enjoy sports, an active lifestyle, or even affect daily activities such as walking or taking the stairs. When an ankle injury is left untreated, it can cause progressive pain and disability. Over the years in SGH, we have successfully treated a large number of patients with ankle conditions with a combination of non-surgical and surgical methods. So as such, we would like to share our experience today. We have prepared an educational program with three knowledgeable speakers who will share their expertise on some common ankle conditions with everyone. And this will be followed by a Q&A session. So without further ado, we shall begin the webinar. And our first speaker today is Dr. To Rui Xiang. Now, Dr. To is an associate consultant orthopedic surgeon with our foot and ankle service. He has an avid interest in sports, and he'll be sharing on sports injuries in the ankle. Rui Xiang, please.
Morning, everyone. Thank you so much for taking your time on a Saturday morning to join us for our discussion on ankle injuries. And I'm glad to be able to share a bit of what I think and know about ankle sprains, which is a very common problem. You can see in the questions coming in already. So what exactly is an ankle sprain? It's often an interesting injury to the ankle, and it's one of the commonest sport injuries that I'm sure all of you have experienced at some point in your life. How does it present? Comes often with swelling. Often you might see some bruising, and of course, you will see pain as well. So, what kind of ankle sprains are there? There are what we call invergent injuries, which is commonest, where the ankle turns inwards, you sprain the ligaments on the outside. And on the other end, there are people whose feet turn outwards, and you sprain the inside ligaments, which are a little bit less common. So, what actually happens during an ankle sprain? So, there are two common ligaments, ATFL and the CFL, and these are the ones that bear the most weight and stress when you twist your ankle. And it's commonest for one of either of these two ligaments to be sprained, meaning stretched or even torn. And less commonly, there are other injuries that can be associated with this, including what we call a syndesmosis injury, which is the joint between your shin bone and your fibular bone, as well as bony injuries like fractures or the inside ligaments, as I previously mentioned. So when should you see us? If you have anything more than mild swelling and pain, starting to affect your quality of life and your function, you're hobbling around in discomfort, or you have persistent discomfort even after a few weeks, it's high time you should come and see us for an opinion. So why should you come and see us? Number one, we want to confirm the injury that you have. So we assess you to see if you have any pain, and then we check for any laxity, see if your ligament is just sprained or completely torn. And then we want to rule out whether you have any other associated injuries. These include fractures, which can sometimes be missed if you do not do an X-ray. Sometimes you have a ligament tear as well. And there are also tendons which travel very close to the ankle. They help ankle movement. And these are called your peroneal tendons. Sometimes if you have multiple sprains or a bad sprain, it injures your cartilage, which can lead to arthritis in the future. And we should assess this when we look at you. Also, some people we know are more predisposed to ankle sprains, and they get these more commonly and more easily than others. And problems which lead to ankle sprains include the alignment of your heel, your arches. Often if you have a high arch, in comparison to a flat foot, you're more predisposed to ankle sprain. And also, some people have more lax ligaments, they're more flexible, which is a good thing, but it also leads to higher incidences of ankle sprain. So there are many grades of sprains, as I mentioned. Normally, your tendon can bounce back from any injury, but if you stretch it, there can be small tears, which is a grade 1 injury. A grade 2 is when there's a slightly larger tear, and a grade 3 is when there's a complete tear. But we only know this when we examine you. So a common question we face is, do I need an X-ray whenever I have a sprain? So we do follow some rules from a Canadian study. And when you need an X-ray is when you have severe pain after an injury, and you have tenderness, which is pain in any of these highlighted black sites, as you can see in the diagram on the right side, and you have inability to bear weight, which you cannot stand immediately after the sprain and after rest, both. You have difficulty weight bearing, you have pain, tenderness, and then we'll do an x-ray for you. The next question we get is, do I need an MRI? We often don't do an MRI in the first few weeks, because even with a tear, your body can help to recover. Sometimes it scars down and the ligament is as good as stable as before. Only if you have persistent instability and pain after 1.5 to 2 months, and we review you and we notice that you have laxity on examination, then we'll go ahead to do an MRI. So the purpose of the MRI is, number one, to confirm that you have a ligament tear indeed and how bad this tear is. But at the same time, it's a very sensitive scan. We also look up for other injuries, which include bony injuries like small fractures, cartilage injuries, as well as tendon injuries, as I previously mentioned. So what happens if you have a severe sprain and you miss it, or you choose to ignore it? Number one, you can have a missed fracture, and if the fracture is missed, it can go into malalignment, which is poor alignment of your ankle or foot. You can have recurrent sprains, which you have persistent instability. Whenever you play sport or jog, you feel unstable or you have pain. Or you can have tendon tears, which cause you pain with activities and strenuous movements. You also can have cartilage defects. And these cartilage defects are worrisome because they can end up in ankle arthritis 10 to 15 years down the line. So how do we treat your sprain when you come and see us? If it's a first sprain and it's mild, we often manage you conservatively, and this means without any surgery. We give you some painkillers, including anti-inflammatories, which help with the swelling and pain fatigue. And we follow the standard RICE therapy, which some of you may have heard of before. RICE is an acronym for, number one, rest. We rest the injured area and try not to strain it for the first 2 days, which is 48 hours. We also encourage icing, 20 minutes at a time, 4 to 8 times a day, as much as you can afford, without direct ice. So you put it in a plastic bag, you cover it with a towel, and then you put it over the injured area. And then mild compression to help reduce the swelling, nothing too tight, and elevation. So you lie in bed or you put your foot up on a stool to help the blood flow and to help the swelling to be reduced. When your pain is better, we start you on some physiotherapy, which our kind physiotherapists will expound on later. We do strength training, range of motion, and we teach you to recover your balance, which is something that's often neglected. And we try and avoid excessive immobilization. So contrary to the popular belief, we try not to rest in an ankle guard for too long, because this causes your muscles to become lax and lazy, and this predisposes you to further sprains. So excessive immobilization, as I said, is a thing of the past. While it does protect the ligaments, it restricts your overall range of motion, which then results in the future in a stiffer ankle and weaker muscles overall, which then is a vicious spiral downwards, recurrent sprains. So when do I need surgery? Of course, it's always a last resort. We try hard to avoid surgery whenever we can. And often patients, number one, they miss their diagnosis at the start and they continue to strain and injure their ligaments further by participating in sports before they are recovered. And they have persistent instability, even though we have tried physiotherapy, strength training exercises, and rest. Or they have associated injuries to the bone, like fractures, or cartilage ulcers and injuries. So what exactly does the surgery involve? We have open techniques, and nowadays we are moving more and more towards keyhole and arthroscopic techniques. Arthroscopy techniques are, as you see in the picture below, where we use a camera as well as a working portal, both of which are about 1 centimeter long, and we visualize everything through a camera, a keyhole camera. We see where your injured ligament is, and if it's early on in your injury, we can repair it with small sutures. And if it's late, we often need to use grafts to reconstruct it. However, this is much rarer. So most of our patients end up with small keyhole surgeries. They take 4 to 6 weeks to recover. We start them walking slowly on a cast first and then a boot. And then they see our physiotherapist at about 6 weeks. They go on to do sports at about 3 months. So how is the recovery? As I mentioned, the recovery time varies depending on the procedure, but often, if it's a keyhole procedure, full recovery back to normal activity activities is about 3 to 6 months, depending on the patient factors. In the first 6 weeks, 1 to 2 weeks, we spend it on a cast to prevent too much movement of the wound, to allow the wound to heal well. And then we give you a special boot, as you see in this photograph, where we allow you to walk for the first 2 to 4 weeks on a boot to prevent excessive motion. You then see our physiotherapist for controlled range of motion exercises to prevent scar tissue forming and stiffness. From week 6 to week 12, we allow you physiotherapy to regain your strength and balance. And after 12 weeks, on a case-by-case basis, we allow them to return to sports, and we then monitor you for any complications. Thank you so much for all your time, and we'll be open to any questions after this.
Thanks, Xiang. That's a very informative talk. So I shall move on to our second speaker. Our second speaker is Dr. Lee Zhongxian. Dr. Lee is a consultant orthopedic surgeon in the foot and ankle service. He has undergone advanced foot and ankle surgical training in the UK. He has experience with a variety of ankle conditions. He'll be speaking to us on ankle arthritis. Okay, Zhongxian, please.
Hi, good morning, everyone. I'm Dr. Lee. Thank you for joining us this Saturday morning. And thank you, Professor Tay, for your kind introductions. So for my section in today's talk, we're going to talk a little bit about ankle arthritis, what it means to you, what it means to me and us, as well as what we can do for you. So what exactly is ankle arthritis? Generally speaking, it's a degenerative condition that's associated with pain, deformity, limits in mobility, stiffness. What it means to you, essentially, it's a condition of the ankle that basically hinders you from getting on with your life, your daily life, and affects your ability to perform things that you want, your hobbies, your vacation plans, and trips. A little bit about the background of ankle arthritis. The prevalence is about 1% amongst all population, slightly lower than what we see in the knees and hips. So more often than not, you've probably got elderly friends or colleagues or family members with knee arthritis requiring replacements. But ankle arthritis can be equally debilitating for our patients. So what kind of risk factors predispose you to ankle arthritis? Previous injuries, like what Xiang mentioned earlier on, history of frequent sprains, things like gouts, rheumatoid arthritis, or previous fractures in the ankle as well. And it can be severely impactful on your quality of life because it affects your ability to climb stairs, to go about hiking, to go on holidays, going about work as well. And we do see an increased incidence, possibly due to the more sedentary lifestyle, as well as increased rates of obesity among our population. So what kind of symptoms would hint towards an arthritis problem in you? Very often you may have some pain or swelling in the ankle, more often in the end of the day after a long day of walking or standing. You may find that it limits your mobility, your ability to climb up or down stairs, or you find that after walking a bad 10-15 minutes, you got to sit down and rest a little bit. You can experience pain and stiffness in the ankle as well, meaning that you find that one ankle isn't moving as well as before. You have inability to tiptoe as high as previously, or to perform certain maneuvers in your hobbies or your recreational activities. You may experience clicking sensations as well. So largely speaking, what are the causes of arthritis? Most commonly, we see arthritis after a post-traumatic situation, previous ankle fractures, neglected ankle injuries, history of recurrent sprains. But we do see patients with inflammatory arthritis like gout, autoimmune conditions like psoriatic or rheumatoid arthritis, or you can get primary osteoarthritis from a background of overuse and overloading and overabuse of your ankle joints. So very often we see this group of patients, this kind of symptoms amongst our athletes or our military personnel who undergo a lot of severe physical activity. So they may present with early arthritis of the joints as well. So what can we do for you when you see us? So it will start with a basic medical history about what kind of predisposing risk factors you've got in your previous history of ankle injuries, the nature of your pain, and importantly, how it affects you, so that you can have a proper conversation about how we can optimize it further and improve your quality of life. So physical examination will involve assessment of your ankle, the laxity, the region of tenderness, the associated deformity, and ultimately we will require some form of imaging tests, most commonly x-rays, but we do sometimes require MRI scans as well. So very often these x-rays can be done at the point of care when you see us in the clinic on the same day, where we can clinch a diagnosis and discuss with you what more we can help you with. So for a start, most patients will benefit a lot from conservative treatment options. So this would involve physical therapy, strengthening, stretching exercises, pain management with medications, orthotics and bracing in terms of ankle braces, immobilizers and stuff to help reduce the symptoms. Lifestyle modification like weight loss, low impact activities like swimming instead of running, for example. Or we can also have injections that can be done in the clinic setting on a theater with steroids, lubricants, as well as certain blood products. So when is it that we should consider surgery for you? If you have severe debilitating pain that limits your mobility and your function and affects the quality of life, or if you have failed the course of conservative treatment like what we mentioned in the previous slide, or if there's significant joint damage and deformity resulting in instability. So these are the situations where we can discuss a little bit further with you. But by and large, the main purpose of surgery is to improve your condition beyond what we can achieve with conservative or non-operative management. So what kind of surgical interventions should we be looking at? So there is a range of options available. One would be arthroscopy, which is covered briefly by Dr. To earlier on. I'll go into a little bit more detail subsequently. There is an option called osteotomy, which basically means cutting off the bone in a hope to realign it, to redistribute the weight in the ankle joint and reduce overloading in certain parts of the joint. In the end-stage arthritis, we do end up with the need for ankle fusion, where we prepare the joint and lock it up to fuse it in a solid, non-moving bone. This will no doubt increase your stiffness, but it will definitely cure the pain they're having from the arthritis. And the last option would be ankle replacement, which is something gaining in popularity in recent years with the advances of techniques as well as the prosthetic implants, where we replace the arthritic ankle joint with artificial metal and plastic joint. So in ankle arthroscopy, what was described by Dr. To earlier on, it's a minimally invasive surgery where we have 2 small sub-centimeter cuts in the ankle and we insert a camera into the joint to clean and wash out. I think earlier there was a question by one of your audience members about removing of bone spurs. So this will be quite important and quite useful if you've got bone spurs in the joint that's impinging activity. So this will be assessed by us and we'll counsel and advise you on which spurs requires removal and whether the removal of those spurs will actually improve your symptoms before we carry out this procedure. So not all spurs needs to be removed. The ones that cause you symptoms can be removed and it will provide you some form of relief. No doubt with time, they may reoccur, but if the condition recurs, we can discuss about further options at that point of time. So recovery after this kind of procedure is fairly quick. The wound recovers in 2 weeks and you're allowed to start walking with some form of protection immediately after the surgery. So in osteotomy, as you can see on the picture on the left, we see an ankle joint that's kind of malaligned, where the line across the joint is not parallel to the floor. So as you can see, logically, this one means that it loads more onto the part of the joint that's higher up compared to lower. So what we do is that through osteotomy, which means cutting of the bone, there will be an incision on the skin and the bone is cut and opened up and realigned and held in place with metal plates and implants to let it heal in a better alignment so that the distribution of forces is balanced out, and this will reduce the symptoms with the overload. So one of the options for end-stage ankle arthritis will be ankle fusion. So this can be done in an open fashion with a large incision, or it can be done arthroscopically with 2 small minor incisions where you prepare the joint from inside with minimally invasive techniques. So this will involve preparing the joint, removing the spoiled cartilage and bone, and putting metal implants like screws and plates across the joint to hold it in place. So unfortunately, this requires some form of fusion to occur before we can let you walk. So the downtime for this kind of surgery is slightly longer and slightly cumbersome in the sense that you require some form of cast or boot for the first couple of weeks to months after the surgery. All right. So the last option that we're discussing today would be that of a total ankle replacement. Somewhat similar to what you've probably heard of other patients getting total knee replacement or hip replacements. The ankle can similarly be replaced through an incision from the front of the ankle. The bad bone and cartilage is sawed off and removed, and a metal implant is placed into the joint. So this is an alternative to ankle fusion. It helps reduce the pain symptoms, but at the same time, it maintains some form of ankle mobility. So this is especially good for patients who still wish to have more active lifestyle in the form of dancing, for example, or if they enjoy their frequent hikes and walks in the evening, this will be quite a good alternative for them. All right, so what can you do on your end to help prevent and to avoid aggravation of symptoms? So regular exercise, low impact activity helps to keep the joint healthy and mobile. Proper footwear would help as well. So things like proper sport shoes with good support as opposed to stilettos or flip-flops would help prevent undue stress to the ankle. Weight management would help as well. So every ounce in your belly would help with contribute to the weight through the joint. Right, so logically speaking, a healthy weight will definitely decrease the load shared by the joints as well. Last one will be for regular checkups. If you've got certain conditions like frequent sprains, like what Dr. To mentioned, what frequent checkups with your surgeon or your general practitioner would be helpful in the case that certain things can be done to prevent its progression into arthritis subsequently. So on your part, if you've got some form of pain in the ankle, what can you do? So you can go for heat or cold therapy to help loosen the joint or to reduce swelling after a day's use. Some stretching and strengthening exercise will be beneficial as well. So very often our physiotherapist colleagues will help with this. I think Zhenhua would further expound on this in his talk later on. Or you can use assistive devices like walking aids or ankle braces to help stabilize the ankle and reduce the tension and stress on it as well. All right, so to answer the question, with ankle arthritis, is this the end of line for me? Definitely no. There are options available readily for you, be it conservative or surgical. So as for which is more suitable for you, this will be after a thorough conversation and assessment with us before we can counsel and advise, what's most appropriate and beneficial for you. Right, thank you.
Okay, thanks, Dong Xian. It's a good speech on ankle arthritis. And we move on to our third talk. Our third talk will be by Mr. Pu Zhenhua. Now, Zhenhua is a physiotherapist at SGH with a special interest in foot and ankle conditions and has been working with the foot and ankle team very closely for various ankle disorders. And he'll be speaking on prevention and management of lateral ankle sprains. All right, Zhenhua, please.
Good morning, everyone. Thank you for Dr. Day's presentations and introduction about me. Yes, next one I'm going to share on my slides. If you need to share my slide first. These are the agenda that I will share with all of you. So we will start with explanation on what's lateral ankle sprain and when some of the signs and symptoms to know on, and when to seek medical care. And just now, Dr. Do has mentioned quite a little bit on that. And we'll talk a little bit about the contributing factors towards the lateral ankle sprain. And if you have an ankle lateral ankle sprain, what are things that you can help yourself after the ankle injury, and as well as physiotherapy management. Yeah, and then we will end the session with a little bit of a take-home message. So we will start with what is lateral ankle sprain first. So just now, Dr. Do mentioned about that there's an injury whereby it is ankle rolling inwards and pointing downwards, and you can see that on the pictures on the right side. There will be some sort of inversion, so what we call is ankle pointing inwards, and then usually the affected area will be the ligament on the outer part of the ankle. So it overstretch and tear of the ligament and at the outer part. And about 75% of the ankle sprain are lateral ankle sprain. Mainly affects adolescents and young adults in the sports. And just now, Dr. Do also mentioned a little bit about the extent of the ligament injury. So we can classify this lateral ankle sprain according to the extent of the injury of the ligament. So for grade 1, you can see the picture on the right side right here is about just a little bit stretch and some small tears, probably not. And the swelling usually may not be that much, maybe have some redness, no bruising, or a little bit painful to press on it. Whereas for a little bit serious like grade 2, you can see on the diagram on the right side, the ligament actually is overstretching to an extent that is a little bit rupture, or what we call partial tear. And it can present with moderate swell and bruising and painful to touch it on. So this just now Dr. Do mentioned about in his pictures that can show there's some swelling in the diagram from his previous slide. Whereas on the last one is the grade 3, it's a complete rupture and it can be quite serious. So you can see that the picture that Dr. Do mentioned is you have a bruising around the outer part of the ankle and then very puffy and swell redness, and you have a lot of difficulty of putting weight on it and walk. So usually this kind of presentation of swelling and bruising will be very obvious, especially in the first few days. And it's very difficult for you to putting weight on it and the injured leg. And just now, Dr. Dom also mentioned about using the Otava ankle rule. So if you find yourself the ankle swell and it's tender to press it on the bony area, and if you are unable to weight bear and walk for 4 steps immediately after the sprain, then it's definitely you should go and see a doctor, right, to rule out the possibility of a fracture on the bone or some other structure like a cartilage or ligament, not only ligament but muscle tendon injury. Yeah. So we can talk about a little bit more of the contributing factors for the lateral ankle injury. Similar from just now, Dr. Do mentioned that we can classify them into 2 categories. We can talk about things that happen to the person itself. So we can look at intrinsic factors. So intrinsic factors we can talk about is the structure of the ankle. It can be the ligament, it can be the mobility of the ankle joint. So some people born with a very flexible ligament, flexible ankles. And also we can think at the muscle performance. So probably some of the muscle at the ankle that's not that strong, then can put at risk of higher risk of lateral ankle sprain. And also if you have a previous ankle injury before, maybe not once or twice, then very likely you can have another recurrent ankle sprain. If a person with increased body weight, that can put someone in a higher risk of lateral ankle sprain as well. So on the other hand, we can look at the extrinsic factors. So these factors are outside this person. So we can first looking at the activity. So usually sports activity, for example, court sports usually tends to have a higher risk of lateral ankle injury rather than a field sports. Inadequate warm-up before the activities, that can put someone in risk, like too much of impact suddenly, or you engage in the activities without some proper warm-up or preparation on it. Or during the activity itself, you accidentally, like sort of close contact, step on somebody's leg and or step on the opponent's foot, and then you can have a higher risk in result in the ankle sprain. And yes, footwear. So you shouldn't wear the slipper or sandal to play soccer, play basketball or soccer or things like that. It's just not giving us enough support and stability for the foot and ankle. And finally, the environment itself, if the ground is uneven, it also can contribute to the risk of lateral ankle sprain. So what can we do and how can we lower down this risk? Just now we mentioned about if somebody is very flexible, then that will have a higher risk. But on the other hand, we do have somebody that is someone that with rigid ankles and lost the flexibility of the muscle around the ankle itself. So you can look at the diagram on the right side. You can see the person is leaning against the wall. So what is he doing is that he's actually stretching the leg at the back here. He's stretching the calf muscle, and that can help to improve the flexibility of the calf. And that helps to improve the flex range of the ankle as well. So that helped in a sense that improve the flexibility. Just now, I do mention a little bit about adequate warm-up in the previous slide a little bit. So before the activities or sport that we want to engage in, we should do some activity to speed up our heart rate, like for example, forward step up, stationary cycling, or have some slow jogging to just get the body and the foot and ankle to warm up and get ready. And if you have a previous history of lateral ankle sprain, then I think it's better to have an external support like a brace or taping to give the extra support and stability for the foot and ankle. Appropriate footwear, definitely wear the right kind of shoes for the right kind of sports. So wear the sports, for example, badminton, then you should wear badminton shoes instead of wearing basketball shoes or running shoes. Finally, yes, most of just now our doctors mentioned about, also for us, physiotherapists will be prescribe you some balance training that can improve the stability of the foot and ankle. Through this training, you can sharpen the sense of positioning of the ankle and foot and ankle joint, as well as the body position and postural control. So what if you really injured yourself from a lateral ankle sprain? Things that you can do, Dr. Do just now mentioned about using the principle of RISE. So R stands for rest, okay, I stands for icing. So usually we can ice on the area for about 15 to 20 minutes and every 4 hours, and we can use compressive bandage and elevation to help to reduce the swelling of the ankle in the acute phase. So usually it's happening after the injury for about the first 48 hours or first few days. And the elevation usually can be done with foot elevate, for example, with 2 pillow support or 45 degrees high. And this usually can be sufficient in terms for grade 1 injury. Whereas for grade 2 and 3, a little bit more serious, then besides using the RISE principle, we can also need to immobilize injured ankle with some external support like a brace or even a boot. So what else that physiotherapy can help you usually is for example, in a scenario whereby you have a recurrent ankle sprain. It means after once you recover quite well, but then again your ankle sprain again and again. So or maybe you have a grade 2 or 3 injury. So when you come and see our physiotherapists, definitely education, I think, is a big portion of it. We will answer your concern and your worry about how you're going to walk, how you're going to go back to your work, get back to your sports, what's the estimate timeline. And like just now, Dr. Do and Dr. Lee mentioned about, if it's not surgical intervention, what conservative management can help you. So usually the patient come with a lot of pain and swelling, and we will use, like, for example, electrical modalities that can help to speed up the recovery and reducing down the pain and swelling. And in terms of gait training, because the ankle is it is very painful and it's having difficulty to walk, so therefore we will teach our patient with some protective weight-bearing technique. So if the doctor prescribe you with boots, definitely I think it's hard to walk just the boot itself. We will need to give you, like, teach you how to walk with some walking aid. So a picture on this right side will be a pair of crutches, or can be a walking frame, depends on your ability to walk. And we'll teach you how to go about walking with this walking aid together with the external support in terms of flat ground, turning, pivoting, probably turning in the ground, how to sit to stand, how to even manage crossing curb, and as well as going up and down the steps. And finally, we will give you some structure exercise. So just now, Dr. To and Dr. Lee mentioned about the exercise prescription. And usually, when the pain and swell control quite well, we do need to do some exercise to restore the range of motion of the ankle, as well as the flexibility of the muscle around the ankle, and improve their strength and improve their balance, sense of position. So for grade 1, if just outstretched ligament, it can be estimated that 2 weeks we can go back to a desk-bound job. But what if your job, the nature of job is not desk-bound job that require lifting or standing and walking quite a lot? then it would be recommended to, for example, not to leave to object, sorry for the typo error, should be object of more than 10 kilogram. You should limit the amount of standing and the walking, especially on uneven surface. And then it will be projected about return to full work in about 3 to 4 weeks and beyond, and depends on the task requirement. For grade 2 and 3, because the injury is more extensive, so the healing time or the return to work or return to sport will be a little bit longer. So about 3 to 6 weeks, you can resume back to your desk-bound job. And for lifting wise, sorry about the typo error. It should be more than lifting object more than 10 kilo and must limit the amount of standing and walking on uneven surface. And the project return to work, the timeline even can be further down to 6 to 8 weeks and beyond. And it depends on the task requirement and the result from the physiotherapy session. So if you have concerns regarding return to work when you have the lateral ankle sprain, it would be good that you share your concern and worry with our physiotherapists, and our therapists will make the contact to our return to work coordinators, whereby he or she will probably draft out a return to work plan to ease you gradually back to your original work. So therefore, that will be acting in a way that need to contact your supervisors and have some recommendation for you before you really gradually to do the full task. On the other hand, for return back to sports, we have a team of therapists that specialize to helping you to get back to the sport through a structured return work planning. There's some assessment and subsequently to find out some area for improvement, and probably about through a few sessions to help you to get back to the sports that you would like to get back to. For grade 2 and 3, or you will suffer your ankle once again and again, very likely can develop into a chronic ankle instability. So what it means is that you will feel your ankle is not that stable. You feel that quite loose. You feel that it's repeated giving way. For example, sometimes you just trying to catch up the bus or walk a little bit faster, even on the flat ground, and then you feel your ankle is rolling inward again. And this can happen for more than about 3 months to a year after the first acute injury. So, what exercise can you do? So these are some of the examples the physiotherapists will teach you. But I think probably if you would like to do this exercise that I'm going to give you with some guidance from the therapist, so that they can give you the right form and the right guide you along doing the exercise at the right form and with the right dosage. So let's start with on the activation of the muscle. Once the pain and the swelling settle down, you can, even when the pain and the swelling is getting a little bit better, you can start activating the ankle muscle already. So you look at the diagram on the right side, the first diagram is pointing the toe or the ankle towards yourself with a blocking of the ball. The other direction will be pointing downward, whereby the toe and the foot pointing downward and is blocking by the ball. The second picture on the right side is pointing your foot outward towards the wall, towards the ball in this sense. You can push in that direction, these 3 directions I mentioned just now, and hold it for about 5 to 10 seconds. And you can repeat 10 times. You can do it about 2 to 3 sets, and you can do it 3 times a day and on a daily basis. So that is especially for the muscle at the ankle level. On the other hand, once it's getting better, we can even load the lower limb muscle a little bit upper up, for example, the knee and the hip area as well. So that can be achieved or done through a double leg squat, or similarly with a 5 to 10 second hold. You can do it 10 times, 2 to 3 sets, and then you can do it on a little bit daily basis. The idea behind is to restore the ankle and the adjacent joint muscle strength and activation. And next, we talk about flexibility. Usually after the ankle sprain, the ankle can be quite stiff as well. So the stiff ankles, what we can do is the picture on the right side, the person actually is stretching the calf muscle right here with a towel. And we can do this when the swell subsides. And this can be done through the towel pushing towards your cell and hold it about 20 to 30 seconds. And you can repeat about 3 times. Whenever you stretch, you can stretch 3 times a day and do it on a daily basis. Once this one, you can do it quite well. You can progress to putting the body weight and stretch the calf and improve the ankle range through this knee to wall stretch. So this picture on the right side, you can see the person is trying to bend the knee on the left side, but actually the stretching leg is on the right side right here. So the knee keep it straight and you feel the pulling sensation, and then you can have the calf right here to stretch and improve the flexion range. And this help you to restore the flexion or range of the ankle, as well as the flexibility of the calf muscle. Now, finally, come to the balance exercise. So we can, start with some basic standing balance first. So having both sides of the legs side by side, and then having a heel raise up and down, and you can repeat about 10 times. You can do about 2 to 3 sets. You can do about 2 to 3 times a day on a daily basis. If you find that it's getting 2 legs easy, then probably you can progress to use a single leg standing balance. So like the picture on the right side here, the person like standing on the on the left side of the leg, and then try to balance for about 20 to 30 seconds, and then try to minimize the sway. And you can repeat 3 times, and then you can do it 3 times a day on a daily basis. So balance exercise is meant to improve the ankle and foot stability, as well as the adjustment of the body in response to getting the center of gravity fall within the base of support. If you find all these basic standing balance is getting easy for yourself, then probably what we do is getting a physio to guide you to go a little bit more dynamic in manner. So we can have a dynamic standing balance. For example, having the toe walking. So you just tippy toe walking for about 5 to 10 meters, and then repeatedly for about 4 to 5 rounds. Or you can incorporate the dynamic standing balance to a little bit more towards the game that you play. Like for example, if you play ball games in the court, then probably you can choose to single leg standing balance, and then with somebody tossing the ball to you and you catch it without losing balance. But I would still advise that the exercise that I mentioned above, it would be good that to have therapy supervision to guide you along, also to answer the query that you have when you were trying to do this exercise. So we'd like to have some take-home message for the audience. So the first one will be to seek medical care, because the swelling itself can be quite substantial as well as the pain. So therefore, using the Ottawa, the ankle rule, just now Dr. Doe mentioned about, you need to see the doctor in order to rule out the possibility of a fracture, or can be even a cartilage or a tendon injury. And that happens when you're having a lot of difficulty of weight bear and walking, or even for four steps. So please go and see a doctor in that sense. And for physiotherapy, we'll give you a structural rehab. So just now I have a brief introduction on what type of exercise that you can do besides the Bryce principle that you can help yourself, right? We can restore the range of motion of the foot and ankle. We can get the flexibility of the foot and ankle. In fact, we don't just confine to the foot itself. We also do some training above the joints, like at the knee and the hip, or even your truncal control itself. Right? And finally, when you have an ankle sprain, right, it's very important for you to raise up your concern and worry about those things. And if regarding return to work, then we'll get the therapies to liaise with our return to work coordinator, right? Have some recommendation to your supervisor, have some recommendation return to work plan to work with you. On the other hand, for return to sports, Then we have a team of physiotherapists who help you, right, understand the goal of your return to sport, lowering your baseline, and help you to get back slowly to where you stop from the injury. So I will end the session with today's final message. A good rehab post-ankle sprain can help you to return back to your desired activity with confidence. So therefore, please come and see our therapists and our doctors, right? Give you some guidance, get yourself be more confident, and so that you do not suffer another ankle sprain again. And that's all from me. Thank you very much.
Thanks, Tanhua. That was a very informative talk as well. So we have come to the end of the three talks, and thanks to all three of our speakers for excellent presentations. So now we'll move on to the Q&A session, and some of the questions we've answered along the way, and any other questions we can answer live as well now.
Yeah.
Okay, I saw that. Zhong, go ahead.
Okay. Yeah, there was this question about PRP injection. I think that was covered a little bit briefly in one of the options when we discussed about the treatment for ankle arthritis. So to simplify, what is PRP? I think we did mention it a little bit as when I briefly mentioned about injection of blood products. So what we do essentially is that we will draw some blood from you, spin it down, extract the plasma layer with the rich content of platelets within. It's supposed to have high levels of regenerative and growth factors. So, and use it to inject into the areas with inflammation or degeneration that requires assistive regenerative function. So, evidence-wise, amongst the literature and globally, I think its most clear-cut benefit is for the use in plantar fasciitis that some of our attendees have mentioned. But its role in arthritis is a little bit more debatable. However, it is still an option available, considering that steroids has its own list of side effects and complications as well. So I'll leave this conversation between you and your doctor if and when you do eventually come to us.
Hi, so I wanted to also answer one of the questions from Yifeng about whether or not ankle guard is required for patients with ankle sprains. So as I mentioned before, the ankle sprains you call them in the start, they often use ankle braces, which are slightly more rigid, only in the first 1 to 2 weeks, in order to prevent further injury to an already injured ankle. But on a long-term basis, the ankle brace is often counterproductive as it over-immobilizes the reduced range of motion and stiffness, and it also causes the muscles and tendons to be less able to balance. Sorry for the background noise, but basically, in short, the ankle brace is only useful at the start, but not as a long-term solution to your ankle. You should instead come and see us for a review to see if a repair is required, and also work with our physiotherapists to see if exercises can help you regain some of that mobility.
There was a question about metatarsal pain relating to ankle arthritis. So a metatarsal refers to the ball of the foot, the forefoot actually, just a little bit closer to the ankle compared to the toes. So when you walk, you do put a lot of weight over there, and most patients, in patients who have this problem, very often it can be due to things like a tight calf muscle, overly long metatarsal, or even a non-functional big toe, like in the cases of patients with hallux valgus or bunions. They may get such symptoms as well. Is it directly related to the osteoarthritis of the ankle? Probably not, but fret not, you can still come and see us for the same problems and we won't turn you away.
Okay, there are some questions about ankles are popping and clicking with movements. So these are usually not related to arthritis, but depending on the injury, sometimes the clicking can be related to unstable tendons or previous injuries with scar tissues within the ankles. But usually, if there's no pain, clicking alone should not be a reason for any concern. However, if there's a clicking and a persistent pain in certain parts of the ankle, then we should get it checked out because the clicks can be a sign of unstable areas or scar tissues that can cause a further injury as well.
I do see another question regarding the diabetes. Do ankle exercise help to reduce the slight water retention? I think in the first place, it would be the diabetes condition has to be controlled well first in the first place. The retention itself, I think for elevation of the leg and have some contraction of the ankle using the calf muscle or moving the ankle in all direction can help to a certain extent. But I think it's better to go back to the root cause that getting the diabetes under control. Yeah, and not to excessively too much weight bearing when it's swell. So get the leg to elevate a little bit more first, have some compression bandage that can help to sort of ease a little bit, but I would say that it to a certain extent only.
Hi.
Okay, I see that there's a question on the knee osteoarthritis and whether they will induce ankle discomfort. So, knee arthritis on its alone does not cause ankle problems. But however, many people with knee arthritis, for example, who have crooked knees or bow-leggedness and other malalignment problems in the legs. So, generally speaking, if there's any uh, alignment problems, meaning that the legs are crooked or they are either bow-legged or knock-kneed and such deformities, they can eventually lead to ankle problems as well because the deformity means that the ankle is kind of the weight goes through the ankle in an unnatural angle, and over a long period of time, this can cause ankle issues. So if you have significant deformities in the legs, it can cause ankle problems, and it should be treated as well.
One of our anonymous attendees asked about his ankle being unstable with chronic pain and swelling. Should I be worried, and when can I consider surgery? So nothing is too small to be worried or to be brought up to us for discussion. It really depends on the kind of symptoms you're having, whether it's pain from your day-to-day walking, or is it pain from your daily morning tennis games. That makes a very big difference as for what kind of treatment you may require. So if there's anything of concern, do not be afraid to bring it up to your GP or polyclinic doctor or even to us, and we can discuss and assess it a little bit further and discuss what's the best course of management for you.
Okay, I see a question on the authority on the she does badminton, swimming, and gym. Despite being a 66 years old, still very active. And I think firstly, that's great. It's good to hear that many of our patients are becoming active even as they get older. And it's very important to maintain an active lifestyle to keep your strength, balance, and so on, and keep yourself healthy. So, regards to whether you should, cut down your activity level due to age, I think it's very individual related. So if you have been active all your life and you feel that you're able to continue, I'll say to continue as much as your body allows. However, at the same time, as you get older, it's natural that that you can get aches and pains in the joints, degenerative disorders. Now, there is no evidence that suggests that, no signs that suggest that if you continue playing sports or that, as you get older, it can result in more problems. In fact, if you maintain activity as you get older, it's a good thing. However, of course, you must take the appropriate precautions such as warming up, getting the appropriate footwear and equipment to do your exercise to reduce the risk of injuries. Because as you get older, when you do get injured, it does take a long time to recover, longer than when you're young, and therefore you should be careful to prevent the injuries that can come if you do not take the precautions.
There's this question by Derek. Both ankles swollen without pain. What caused this? It's a bit hard to tell. Very often when you have both of your feet and ankles swelling, especially when it extends up to the calf or the knees, it may be a medical problem like a heart, kidney, or liver problem. So it will be good to seek consultation with your GP or polyclinic doctor to get it ruled out. It is true that ankle arthritis or foot and ankle conditions can cause swelling as well, but very often it is associated with some form of pain or stiffness, or it involves one side more than the other, and it's related to more so with activity than all the time. I hope that answers your question.
So there's another question by Lee Fong. She asked if there are any exercises which should be avoided for people with a great shin tear. So this really depends. A grade 3 tear indicates a complete tear, but we know from experience that some patients, even with a grade 3 tear, can heal and start out enough to be stable in most of their activity. So if it's your first sprain, even if it's a complete tear, some patients do go on to recover with physiotherapy and drugs. It's still stable in most activities. But if you have persistent pain and instability despite these activities, often they feel unstable when they walk on uneven ground, or they do exercises with required pivoting like badminton or tennis, where there's a lot of turning and pivoting, then you should definitely come and see us for a review. But it really depends on how you feel after recovering. So the grade 3 alone is just one part of the problem. We also assess how well you're functioning, how well you've recovered from this grade 3 pain. It doesn't always mean you need surgery, or it doesn't always mean you have any activities that you need to avoid. Thank you.
Yeah, I would like to follow just now what Dr. Do have mentioned about. So usually patient, if we can go for the initial trial for conservative management. So for the physiotherapy aspect, it's definitely we will be looking at an assessment on the area that you can improve upon. Despite having one ligament that is have grade 3, but on the other hand, we do have some other muscles that we can help to train upon, especially in terms of reaction time, as well as the muscle strength and the proximal part of the body, those lower limb joint. So this can be improved some through training. If you should find that after, for example, more than 3 to 6 months, that's not improved, then it is advisable that continue this discussion with the doctor again and see whether there will be a need for intervention in terms of surgery. Yeah, thank you.
Okay, there were some questions related to ankle arthritis and flat feet, and I think that and whether ankle replacement is recommended for people with flat feet. So, in general, the ankle is a kind of a very closely associated with foot disorders, including flat feet like low arches or cavus foot or high arches. So, deformities in the foot such as these over the long term or when very severe can eventually result in ankle problems because of the way you walk. So depending on the severity of the problem, the flat feet or the high arches may need to be treated at the same time as your ankle arthritis if you have such a problem. So it really depends a lot on the assessment and how bad each condition is. A lot of time, things arch-related problems can be treated with footwear, insoles, and so on, and they may not necessarily require surgery. But if they have come to the stage where they affect the ankle, then something may need to be done either for the arches or the ankle or both, so depending on where the problem is. So it's a bit slightly more complicated because then you have two problems.
Hi. Yep. I think there was a question by one of our attendees, Sharon. I think the symptoms they described sounds more like a plantar fascia problem. So there are a whole range of treatment options for it. I think we've covered previously in one of our webinars as well. Things like physiotherapy, heel inserts, insole stretching. If all else fails, there might options for injections as well as surgery. But majority of patients do fare better with a course of conservative treatment. Do come see us for further advice. There are also further questions about getting appointments with us as well. So this can be done either via through calling them or contacting SGH directly through their hotline, or you can get a referral through your GP or polyclinic as well. Either way is acceptable.
I have seen one question that regarding physiotherapy after the ankle sprain recover can actively do therapy exercise, for example, balance movement. I think usually what is better to get the physiotherapy to assess first before you step on it, start doing the balance exercise, because probably people looking at whether the joint has the flexibility or the muscle around it have the flexibility and mobility and the strength to go about doing it or not. So in fact, you can see just now the sequence of how I prescribe the exercise. We can start with actually activation of the muscles first, and then restore the range of motion. Only when the muscle have the strength and the range of motion, then your balance will be a little bit better. So we would not jump straight away to, like, for example, a standing balance like this. I hope I have answered your questions.
There were a couple of questions about bone fragments in the ankle. Without going into too much details, this probably sounds like you've been told that you've got some loose bodies in the ankle. Sometimes these kind of thing can happen after previous injury or as a result of degeneration, arthritis, where bone fragments and bone spurs form. So these loose bodies in the ankle may cause symptoms in terms of impingement, or it may grind and cause clicking sensation. If those are present, there is always an option to go in and remove these small fragments and prevent the impingement symptoms. However, if they do not cause you any problems or pain, largely they can be watched and monitored.
I think there's a question by Che Kiang Chua, and I think this is good to answer because he asked an injured ankle can cause pain and aches all the way up to the calf, knee, and buttocks. So this is absolutely uncommon. If you have such pains, it would be best to have your spine assessed. It's very common for spine problems to manifest as pain elsewhere in the limb, the knee, the ankle, the buttocks. So we often refer those patients to our spine colleagues for an opinion. So it's best to come in for a review first before we start what's best for you.
Okay, I see another question regarding about a soft ankle. So if you mean it's a soft ankle, it's a very flexible ankle, then that would be something that just now we mentioned about that the ankle itself is have a ligament that is very flexible. Then toe tipping exercise would be can be done, but I think there will be a lot of basic scaffolding exercise first. So instead of straight away do a toe tipping, we would still like to looking at whether the muscle, because it's flexible, so you do not have a range of motion problem. Then we would like to take a look at the muscle control, especially even the first toe, right? And if you're doing a toe tipping exercise, probably we will start loading it on in a more supported position, for example, like in a seated position. And then we will get on some additional resistance level in terms of the heel raise. Once these are done well, then we will progress to, for example, in a standing or weight-bearing positions. So I hope that I answered the question. So if you have a soft ankle, probably we don't do the toe tipping straight away first. It's better to get the physiotherapy to assess whether that is appropriate. Yeah, thank you. I have seen another question about what are some of the exercise that is good for foot and ankle. That depends on the assessment, honestly, because we from the previous slide we have seen that if the ankle itself is not flexible, then we would like to improve the ankle's mobility first. Of course, most of the ankle after injury could be quite stiff. Then we will need to work on the range also for the knee as well. So even the flexibility of the muscle on the upper part of the lower limb, for example, your knee and your hip, it does play a part as well. So I think it's better to come and see our therapist and have an assessment. And then we will tailor the exercise accordingly to your condition.
Think there are quite a number of questions on trying to avoid injuries or prevention of injuries. So especially for ankle sprains or other things like that. So in general, for prevention of ankle injuries, usually for taking part in sports and as we get older, things like footwear is very important. So good appropriate footwear. So if you're going jogging, for example, to have the appropriate running shoes, so that you have adequate stability. Maybe you want to modify it. So, for example, reducing the running on uneven surfaces or trail running if you're getting older. So, flat surfaces and all this tend to be safer to prevent sprains. If you have old history of ankle sprains and you feel that your ankle is not so steady, wearing an ankle brace when you're doing the exercise can also help. So things like this can help to simple measures can actually help to prevent injuries. And of course, if you take part in do the physiotherapy exercises like Zhenhua has mentioned, things like strengthening exercises, It can also help to improve the balance and help to prevent serious injuries when you do any sports.
Right, so I think there have been quite a few questions about patients who have pain at a certain area or swelling at a certain area, and they're worried about what it could cause. So unfortunately, there's no easy answer. The foot is one of the most complex joints in the body, and that's why we are subspecialists in the area. Even after training for so long, we train further in a specific area. There are many joints, many tendons and ligaments, and all of this can cause pain, swelling, discomfort. So I think if the basic answer is that if this pain troubles you and persists for more than a few weeks, it will still be best to come in for a review. Unfortunately, we can't give you a simple, straightforward answer because there are just too many causes, too many solutions that it's best to come in to us, have a look, speak to you, to examine you, same for further tests, so that we can give you a more personalized diagnosis and answer. It's a much more accurate way to help you. But basically, as you get older, we should be avoiding very high impact exercises. I often suggest people avoid things like Zumba or weekend soccer, for example, if you don't really train. Because you really need to be conditioned for such high impact sports. But long story short is, if you have pains or discomfort that are troubling you significantly for more than a few weeks, it's best to come in for a medical review by one of us.
I have another question regarding that after doing a physio yesterday for ankle, and then you have a knee pain this morning, and how to help with this. First of all, would like to know the ankle exercise and what kind of exercise is that. So right now it's really hard to tell just by asking this question because we need to look at the movement and looking at what are the joints involved in this movement. So it sounds like it's a combination of the knee and ankle movement. So if you have any query, you can speak to your physiotherapist again. Yeah. Thank you.
Yeah, I see that there are a number of questions on heel pain and plantar fascia pain as well. I mean, this is a very common condition. While it's not on its own related to ankle pain, it's a very common problem. It's often used to due to overuse, like prolonged standing, walking, or excessive a lot of jogging. And it's also partially degenerative as it gets more with age. Plantar fasciitis or heel pain kind of conditions usually respond well to stretching exercises and appropriate footwear with insoles or cushioning. And most of the time, they get better on their own. Although in certain cases, they do become quite severe. And please come to see us if if it doesn't go away with some simple measures, because occasionally we can do things like injections or even minor surgery if needed for plantar fasciitis. Okay, for questions regarding ankle swelling after injuries. So the foot and ankle is a very sensitive part of the body, and it also happens to be a part of the body which is very furthest away from the heart and lowest down in terms of gravity. So it tends to be more prone to swelling in various conditions, water retention and so on, and it's especially so after injury. So after a bad ankle sprain or any sort of ankle surgery or fracture, for example, the swelling can persist for a very long time. And the reason is that, firstly, the healing takes a bit longer. So during the healing period, the swelling is the body's response to injury. And even after the bones or the ligaments have recovered, it can persist to swell for a few months after the injury. And we'll find that usually the swelling is related to activity. So, for example, when you walk more or you go for sports, the swelling can come on after a while. But we notice that if there's a recovery of the injury, this tends to fade away with time. So usually after a few months, this sensation of swelling after sports or after activity will go down. Therefore, so you'll find that your stamina for the activity tends to increase. But if it persists, that means to say that even after a few months, you still keep on getting swelling. Then of course you should come and see us to see whether there's any undetected injuries, which can over the long term cause some problems.
I have get back the reply regarding just now about the knee pain in the morning after the ankle exercise itself. You did some calf stretch and that stretch. Mm, the idea behind is that if you do a calf stretch, we also want to take a look at how you stretch your calf as well. So usually it will be like, for example, the diagram that just now I showed you from the previous slide is the affected side that you want to stretch should be the knee should be straight and get the heel completely in touch on the ground. So that will be keep the knee in a straight position. But on the other hand, if you find yourself is getting a little bit painful on the knee, so what you can do, you can choose an alternative way of stretching. Instead of stretching in this knee to wall position, perhaps what you can do is do it in a more supported position. For example, the other alternative will be in the semi-slide, whereby you get a towel, right? Stretch your ankle and your foot towards yourself, and then hold it in that position. So your knee are very pretty much as well supported, and then it's just simply stretching the calf muscle. I hope this alternative stretch can help you as well.
So there's a question on shockwave as well. So shockwave therapy is useful for soft tissue injuries. So for certain injuries such as tendon injuries like Achilles tendon or plantar fascia injuries, it tends to be quite useful in helping with the recovery of the soft tissue and the tendons. For ligament sprain, sometimes is used to break up scar tissue in the healing process. So occasionally it can help in the recovery. So it's not always necessary, but for patients who continue to have pain or persistent swelling over the area, and we do a scan and there's some scar tissue, then sometimes a shockwave can be useful for a short period of time. Okay, a question on whether it's possible to recover from an unstable ankle and whether the ankle can go back to being stable. So, unstable ankle usually means that ligament is injured and therefore the ankle stability is lost. And the ligament is torn, but the ankle can go back to being stable either with a conservative management, that means to say physiotherapy and exercise, because there are muscles that can compensate and help to hold the ankle in a stable position when you do exercise, and therefore you will not feel that the ankle is unstable during exercise. Of course, if this doesn't work, like I mentioned before, like the ankle continues to feel unstable despite the strengthening exercises, then surgery is the way to repair the ligament and restore stability to the ankle.
Okay, that's another question regarding what are the ways to help recovery regarding modified diet and taking supplements. Example, more protein for muscle loss. Um, that depends on what is the healing process, the timeline. So if you are at the acute phase, I think the way to enhance healing would be the RISE principle, as well as protected weight bearing this way to help yourself. There are some other ways to help you to recover a bit better if you find that RISE is not helping. And I mentioned in the previous slide a little bit about using electrical modality. Yeah, so that can, for example, ultrasounds or TENS, or it's called transcutaneous nerve stimulation. Those can help you to reduce down the pain, and then so that you can move a little bit better. because once the pain is subsides, it's very important for you to regain the muscle activation. So you mentioned about muscle loss. If you are able to activate the muscle and use them, then they will not lose the mass is so much in a way. Of course, supplement not as long as you have a healthy diet and that will be fine. So probably the acute phase inflammation is very obvious. Then probably you would like to avoid processed food or deep fried food because these the food in these deep fried food and processed food, they have the chemicals that support this inflammation, and that can lengthen the inflammation process. So you may try to avoid this food. On the other hand, I think as long as you use the muscle, you will be able to maintain the muscle bound. So if you're not quite sure what kind of example, what kind of exercise that will be suitable for you, please see a doctor and then get a physiotherapy referral. And our therapists will help you answer your question and will be a concern. I hope I answer your questions.
One question by Min on whether or not you can use massage guns on your ankle. I think massage guns are now a very popular thing. They're being sold everywhere. But unfortunately, the ankle is a very thin and small joint. There's hardly any muscle surrounding it. The massage guns are more for deep tissue, deep muscle massages when you have tight muscle, whereas the ankle has almost no muscles around it. They're mainly tendons. So if you use a massage gun, the chance of injury is much higher. The benefits are much lower. So I don't suggest using massage gun on anywhere near your foot or ankle because there's no tissue protection or muscle of any sort.
All right. Right. I think we have come to the end of the webinar today. Unfortunately, despite everyone's enthusiasm and lots of questions, we are unable to answer everybody's questions. But I'd like to thank everybody for their participation and their attention, and thanks to our panel for their sharing. So for further information, you can follow our Foot and Ankle Instagram page and look out for more educational events. So if you have any foot and ankle condition, please feel free to contact us to book an appointment with us via the contact details provided. So I wish everybody to have a pleasant weekend. Thank you all. I'll see you all next time.
Thank you, everybody.